Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Zingle, and I'm joined today by pediatrician Dr. Allison Moll. Today, we're going to be discussing ADHD, or attention deficit hyperactivity disorder, because October is ADHD Awareness Month. We're going to discuss many aspects related to this very common neurodevelopmental childhood disorder that often lasts into adulthood. So if you'd like to know more about ADHD, the causes, symptoms, and signs to look out for, stick around, share this broadcast with your friends and family. And if you have any questions for Dr. Moll, you can ask them in the comments below. Dr. Moll, welcome, and thank you for joining us.
Thank you for having me today.
Of course. Before we begin our discussion today, will you tell us a little bit about yourself and the importance of parents understanding ADHD?
Sure. So I'm Dr. Allison Moll. I'm a pediatrician with MedStar Health. I work over at Wilkins Medical Center in Baltimore, Maryland. I'm a newer provider here, but a resident of Maryland for about the past year and a half. Originally a transplant from the West Coast.
Oh,
But
nice.
yeah, it's good to be here. And ADHD is a great topic to talk about, especially this time of year as we're a few months into the school year and such. And I think we'll go over a few really good nuggets about why it's important, why it's something for parents to think about, teachers to think about, and why it's important to seek treatment for it.
Wonderful. Well, I'm looking forward to that discussion. Thank you so much. Well, let's start by answering a basic question. Maybe it's not basic, but what is ADHD, or attention deficit hyperactivity disorder?
Yeah, so ADHD, it is a neurobehavioral disorder that manifests itself in the form of hyperactivity or impulsivity and inattentiveness at higher levels than we would expect for the average child or individual, which then in turn can contribute to functional impairments. So challenges may be seen like in their school, educational life, in their like relationships with friends and family, and even affecting potentially like work and those types of things down the road.
Makes sense. Thank you.
Yeah.
What are some ways? So you mentioned that in what is ADHD. Can you talk a little bit more about how ADHD can affect a child's life?
Yeah, so ADHD can affect a child in many different ways. Oftentimes, and we'll touch on some of this more as we talk, school is a frequent tension point for a lot of children with ADHD, whether it's difficulty, sitting still in class because we're sitting there, we're getting a little fidgety as we're, previously kids when they're at home, generally they can run around and play, but all of a sudden you go to school, you're being asked to sit in a chair for 20 minutes, for an hour, or a couple hours a day, et cetera. So that can be challenging. Harder sometimes to focus to be able to complete homework because maybe we get lost in the story of the thing that we were doing. And then it's like, what was the next step of what I was supposed to do? Or I finished my homework. Now, can it actually get it into my backpack to be able to turn it into the teacher tomorrow? That can be really challenging on the just completing those regular tasks and follow through. Other areas where it can be tension points is even just in the social relationships, whether it's amongst peers or even between parents and children. Sometimes kids are, if they do have some hyperactivity or impulsivity symptoms and such, parents are frequently having to remind their child, do this, no, you're doing this wrong. And so in turn, that can also, certainly affect self-esteem, as sometimes kids are labeled like, I'm the bad kid because I'm always being told these things. And we want parents to always, feel like they're praising their child just as much as they're also, giving them guidance and helping them grow. Also thinking about safety challenges, sometimes kids aren't always thinking about looking both ways before they cross the street. That can certainly pose risks, or just not thinking before they engage in other high risk behaviors. Maybe they're on a team of, for football and such, and they are not being able to follow the drills correctly because they're off chasing, a bee across the field, or bothering other kids during practice or such things. It makes it challenging for them to be good teammates and good sportsmanship and such. So many different areas in childhood, and then those come, certainly as they grow, like when kids are soon to be adults and they're, engaging in work. Maybe we're having a hard time like being able to be a good employee because we're not able to get our tasks done or showing up for work on a routine basis and such. So many areas of life it could affect.
Yeah, it sounds
Mhm.
like it. Can you help our parents understand where ADHD is coming into play versus a child just having a lot of energy one
Yeah.
day or a
Yeah.
couple days? Can you help explain the difference between when it becomes more of the ADHD realm versus just regular childhood behavior?
Definitely. So that is one of the challenges in terms of the initial diagnosis is we're looking at, okay, how is this child compared to their peers? Is this just an adjustment period or such? The thing with ADHD that we notice is it ends up being higher than the average child. And we have certain screening tools that we use to kind of gauge, is this higher in multiple settings asked by multiple different caregivers of that child, higher than what we would expect compared to other children.
Mhm.
Other things that we look to also are going to be, is there like a persistence of these symptoms? So like, is it only, you know, this just started 2 weeks ago, but there was also maybe we brought a new baby home and all of a sudden this our other child is, wanting a lot more attention and seeking more attention seeking behaviors and
Mhm.
such. So were there new stresses or things that started? So we look really for the persistence of symptoms lasting at least 6 months, and
Mhm.
that it's occurring in multiple settings. And so oftentimes for children, that means we look at home. We ask parents, like, what is the home life looking like? And then we also ask teachers to get a sense of what are the behaviors that are happening there, that those things are being impacted in multiple places.
Makes sense. Thank you. How common is ADHD in children?
So ADHD is one of the most common childhood like neurobehavioral conditions that we see, and there's a few different studies that are out there, but on average, it's about 9.5% to 10% of children in the United States that are affected by ADHD. And then boys are usually about 2 times more likely than girls to receive that diagnosis.
Hmm. Okay. Thank you very much. What causes ADHD? So you mentioned it's a neurodevelopmental disorder. So can you talk about the dynamics of why someone would have ADHD? What's the cause?
Sure. So we don't know the exact specific cause, and usually most of the time there's going to be multifactorial reasons of at least risk factors for a child to develop that. But we do know it's a difference in the way that their brain is processing information and processing specifically things like stress hormones and hormones and such that regulate mood and activity level and decision making, and that those areas of the brain process it different than a neurotypical child. Some of risk factors that we look for in kids start even as early as before they're even born. So, were there any like intrauterine drug exposure to things like nicotine or alcohol or other substances? Those always place kids at higher risk of things like ADHD. Just the family genetics. If you have a first degree family member that has ADHD, you're much more likely to also develop ADHD. It's not also uncommon for a parent to receive a diagnosis of ADHD around the same time their child is, because maybe those symptoms weren't recognized in the parent at that time.
Mhm.
Other things too, prematurity or low birth weight, those have also been associated with higher risk of developing ADHD. And then we also look to for children that have other neurodevelopmental disorders, such as like autism or Fragile X syndrome. Those children have higher risk of ADHD, as well as children that have experienced many adverse childhood events or psychosocial stressors. Those children are also at risk of developing that.
Okay. Lots of different risk factors.
Yeah.
What about signs?
Yeah.
You talked a little bit about that earlier, where you're getting distracted easily. But what are some, can we talk about those again and
Mhm.
any other signs that we haven't mentioned for
Sure.
ADHD?
Sure. So we look at kind of two big domains. So hyperactivity or impulsivity, and then inattention are kind of two big areas. So in the like hyperactivity, impulsivity category, things that we ask about, like, is your child frequently like tapping their hands or their feet, like when they're at their desk or when you guys are, sitting at dinner waiting for your food? Are they oftentimes squirming in their seat with their teacher asking them, hey, you need to sit still or get back in your chair? Do they have a hard time, playing quietly when they're like at quiet time, either at home or when they're in the classroom and such? Do they have a hard time waiting for their turn in line? At the drinking fountain, it's like push kids, get out of the way, jump ahead. Those things can be just a few little signs to look for. And then in regards to things like inattention, sometimes it's like making careless mistakes or just details where it's like, that your child knows how to do those things, but I guess I just didn't do them, forgot to do them. Sometimes kids can be labeled as maybe they're daydreaming or spacing out a little bit, or they will be, start their evening chores and then all of a sudden we went to go take the trash out, but now we're out shooting the basketball, et cetera, because we saw the basketball over there and following those things. Or forgetfulness, losing our books. Not that we use books too much anymore, it seems, but we're losing like our papers or schoolwork, forms for kids to go on field trips. Like those somehow left the teacher but didn't make it home. And then the other important thing too is how are those differences affecting the function of this child? Like, are these impacting them? So our grades are starting to fall in school because we can never get our homework turned in on time. Are we having a hard time keeping up with the load of schoolwork, or are those affecting different relationships, such as at home or amongst peers and such?
All right. Thank you very much.
Yeah.
You mentioned that a child could be diagnosed with ADHD at the same time as maybe their parent because it wasn't recognized in that adult's childhood.
Mm-hmm.
But what age do symptoms typically appear, and when are you typically diagnosed?
Yeah. So I think we've also just gotten better probably at screening over the past few years than we were maybe in parent generations. And I think our teachers are also really helpful at helping pick up some of those things. We don't make the diagnosis before age 4, but certainly we can start seeing signs or symptoms in early childhood. Many children are diagnosed around school age is probably the most common time for kids to get diagnosed. And a lot of that is because there's lots of obviously growth and development that are happening in those first, especially like 5 years of life. And then all of a sudden you come to school and there are more demands, and there are also maybe some of those behaviors that weren't either fully manifesting themselves at home. Once we start putting in the school structure and those things, those can become a little bit more apparent. And so that's oftentimes a frequent time for kids to start noticing things and parents to start noticing things to bring it up.
Okay, thank you very much. We're going to talk more about diagnosis in just a minute. But before we get to that, I do want to again welcome our viewers and say thank you for joining us. We are here today with Dr. Moll talking about ADHD, as October is ADHD Awareness Month. We've talked about what ADHD is, how common it is, how it affects a child's life, signs and symptoms, and we do have more to discuss, but we have some questions that have come in from our audience. So thank you for submitting those questions. And if you have others, please post them in the comments. The first question is from Francis, and his question is really related to something we talked a little bit about earlier, which is the relationship between ADHD and autism. So he's mentioning that there was a diagnosis for autism from his son, and adulthood has become challenging. So managing ADHD and also being autistic, is all that linked together?
Yes.
Okay.
And it certainly, autism it's unique for each individual as well. So there's certainly lots of nuance that goes on with managing those symptoms. But oftentimes we can see some symptoms can become more manageable as we begin treating things for ADHD. But oftentimes, it's very nuanced. So things I would definitely continue to follow up with your doctor on.
Okay, thank you very much. And can you talk about kind of a second part, I think, to his question is around, so children who are diagnosed with ADHD and they become an adult later in life, and that can be very challenging for them. what kind of guidance do you give your patients for the parents to
Mhm.
help them prepare for their ADHD, their child that was diagnosed with ADHD, and how they can prepare for adulthood?
Yeah. So, something that's really important for kids in general, but all kids and especially kids with ADHD is, having structure and routine. I think, in childhood, that's a great time to build regular routines so that we kind of follow a similar pattern with, when we get home from school, we have a similar evening routine, a similar morning routine, similar things that we do on the weekends. Predictability is great. It also helps alleviate some of those tension points where maybe we'd be more likely to get distracted because we know we're kind of following this regular path.
Hmm.
And then, as you move into the teenage years, it's graduated responsibility, right? So, but still having structure, expectations, and routine. And so sometimes that means you need to help your teenager with their sleep routine. Maybe it's helping regulate how much they're on their phones and those types of things. So I think gradual responsibility, but with still good structure and routine in place is important, and it's going to help them in their adult lives as well.
All right. Thank you so much. I have another question from Allison. She's asking if there's a correlation between birth weight and ADHD.
So there have been some studies that have shown that like lower birth weight, which is often in the setting of prematurity, can be a risk factor for ADHD. So certainly case by case basis, but can be associated.
Hmm.
Mhm,
Okay. Thank you very much.
mhm.
And then we have a question from Eileen. You mentioned working with the teachers directly to help manage your child's day-to-day activities. Is there a difference between how ADHD is managed in private schools versus public schools? She particularly has a child in private school and is asking about resources for her school.
Gotcha. I'd say a lot of teachers like that I have talked with and spoken with have all been very responsive at wanting to make their classroom a place that's friendly for kids with ADHD. Um, not all private schools, but certainly sometimes smaller class sizes are really helpful. And I would always certainly like this is a great time of year for parent teacher conferences. It's a great time to get together to ask them what's working well, what's not working, and ways that you can help support your teacher as well.
Hmm.
Sometimes it means like maybe we need to have less distraction or like less stuff up on the walls because maybe that's like a,
Mm,
a point where a kid is facing off in class because they're looking at all the decorations and things around there.
yeah.
um, Again, like what structure and such is in place in the classroom that maybe needs to be a little bit more guided for them. So I'd say overall teachers have been really responsive, I think, from that I've spoken with. And you can always reach out to your pediatrician to help maybe facilitate some of those conversations and such too, of how can we best support your student for their unique needs.
Great. Thank you so much. I had a flashback to my childhood elementary schools, and I just loved the classroom with all of the wonderful things all over the walls, which are really nice. So you don't think about how they could be distracting for a
Yeah.
child with ADHD. So I
Yeah.
think that's an important point because not something that I would necessarily think about.
Right.
So thank you
Right.
for that.
Hmm.
Okay. Again, thank you for those questions. If you have others, please post them in the comments. Let's talk about diagnosis, Dr. Moll. How is ADHD diagnosed in children? And can boys and girls display different symptoms?
Yes, certainly. So there is no one single test, like we don't do a swab of your nose like we do for COVID and say, yes, you have it, no, you don't. But there is, we want to do a thorough just understanding of your child. So we want to go through from, prenatal history to like what was their birth like, were they hitting their regular developmental milestones on time, were there any delays along the way. We want to understand your family history. Are there others in the family with ADHD or other neurobehavioral disorders that may run in there? What psychosocial stressors are present in your child's life that could contribute? Are there, medications that your child is on? And we want to understand and kind of tease out, are there other, certainly there's other pathologies such as like thyroid problems or such that can maybe manifest in similar ways as ADHD. So we want to make sure that we're teasing things out to really understand that we are arriving at the correct diagnosis.
Mhm.
We do have several like validated screening tools. One specifically that's most commonly used is the Vanderbilt. It's a form that we give out to parents. You can actually print them online yourselves too. Um, and we give one to parents, we give one to teachers, and we have them fill them out that look specifically at certain behaviors for like the hyperactivity, impulsivity, inattentiveness. It also helps screen for a couple of other disorders like conduct disorder and oppositional defiant disorder, as there can be lots of kind of overlap in between each of these. So we want to make sure that we're arriving at the correct diagnosis, but oftentimes we're able to. And if your pediatrician is feeling, I think, ever reservations or feeling like your child maybe has, maybe there's a little more gray area or more complexity, we also have in this area great developmental pediatricians and psychologists and psychiatrists that can also assist us in making that diagnosis for children. So.
Okay, thank you.
Yeah.
And how about the difference between boys and girls? Do they
Yeah.
display different symptoms?
They can. So not all of them do, but certainly they can. Boys sometimes have a tendency to have maybe more of the hyperactivity symptoms, and girls sometimes can be more of the inattentive type. Like I said, not always. But what's different as to why we see more boys that are getting diagnosed is because the hyperactivity symptoms sometimes can be a little bit easier or harder, to ignore, right? If you have a kid that's up and running around your classroom, if you have a child that's constantly, if you're saying, please stop talking in class, please stop doing this, those are things that are disruptive to many other children. Sometimes girls, when they are, or children that are presenting with more of the inattentive subtype of ADHD, they might just be labeled that, oh, like they're a little bit more of a daydreamer. They kind of like lose themselves off in space, but that's not disrupting the classroom as much. And so it can be easier sometimes to gloss over those symptoms because they maybe are a little bit more kind of socially acceptable. Not that that's the right thing, but it can be a little bit easier to miss those. So it's not uncommon for girls to be a little bit older when they are diagnosed.
Makes sense. Thank you very much. Let's talk about when a child should be evaluated for ADHD. Can you talk about the timing for that? And who should a parent see? You mentioned, obviously, you're a pediatrician. You mentioned some others, but is a pediatrician your first place to go?
Yeah, so I think pediatrician's a great first stop. And then again, like we all feel a network of support from our developmental pediatricians, psychiatrists, and psychologists that can always assist us in making that diagnosis. I think I had mentioned earlier too, so we don't make the diagnosis in children that are less than 4 years old. So 4 would be the earliest. And we are looking for the persistence of symptoms, so being present for and pretty much consistently in 2 settings for 6 months or more. And so as we said earlier too, oftentimes it is around school age when these symptoms are becoming a little bit more apparent. And we also expect children, when you're 4, when you're 5, like life is exciting. There's so much to explore. And so we do want to tease out and make sure it's not just normal development, but these are truly persistent symptoms and such. So that would be the soonest, but definitely touch base with your pediatrician if you have concerns. This is the time of year when parent-teacher conferences are happening. So if your teacher that you're meeting with, brings any concerns about your child's behavior and such, that's just something I think to tuck away. Our teachers are great, oftentimes at helping recognize children that maybe have higher levels of those symptoms than other children do. And so I think they're really valuable observations to keep in mind. And it's always something to have an open discussion with your pediatrician about.
Yeah, it makes perfect sense. So it sounds like the persistence is there, the long period, the length of time that you've had those symptoms, and is it disrupting your everyday life or disrupting the classroom? Once you feel as a parent that those things are happening and your child is more than 4 years old, or even I would imagine you could even start that conversation before they're 4. They're just not going to diagnose. You're not going to diagnose But it sounds like once you're starting to see those things as a parent, there's something going on.
Yeah.
Have that conversation with your pediatrician, and if other support is needed, you would bring those folks in at that time.
Yeah, definitely.
Okay. Thank you.
Yeah.
So let's talk about treatment options. What are some of the treatment options for children with ADHD, and how do pediatricians determine what the right treatment option is for their patient?
Yeah. So in our youngest population, like our 4 and 5-year-olds, it's not uncommon to start with a trial of actually behavioral therapy. So working with a specific behavioral therapist to help either whether it's environmental controls, but then also working specifically to you as a parent to be able to address those things in a way to help make them more manageable. Many of our patients do end up really benefiting from stimulant medications. Those are generally based either in amphetamines or methylphenidates, which are the most common ones. They're wonderfully efficacious, and a lot of kids just, I think, see such an improvement even in themselves from being able to, because they're not making these deliberate decisions of, oh, I'm gonna, get up and run around my classroom to do this. Maybe there's times when they are, but but their brain is processing things differently, and so not to be penalized for that at all, but we want to help support their brain so they can function to do the things that they need to do. And be great students, and be good contributing members of their family. So we oftentimes will use medication, and generally they're very, very helpful. They come in both long acting, meaning 10 to 12 hours worth of like medication, or we can do short acting medications that last somewhere between 2 to 4 hours in length, depending on what the child's needs are. I do ask patients and parents to be patient as we're figuring out exactly which medication is the right fit for your child. Unfortunately, it's not a one size fits all for everyone, but oftentimes we can get a really good fit within the first couple of changes and figuring out exactly which dose is right for your child. And thankfully, these medications, they act really quickly. And so we can make those changes. It's not, okay, come back in 6 weeks or 8 weeks. Oftentimes we can make changes as quickly as 1 to 2 weeks after starting medications to know if that's, tolerated for the kid, how well we're controlling symptoms and such. So.
Okay, thank you. You mentioned stimulants. Are there any non-stimulant medications that are available for ADHD?
We do have some that are non-stimulant medications. Those are typically reserved for kind of more atypical cases, or where we are tolerating maybe some of the side effects that are utilized in or that are seen within the stimulant classes. Generally, stimulants are very well tolerated, but there are other options. Sometimes those ones are ones that some pediatricians are not as familiar with using. So it's not uncommon if we are having to use maybe more of those atypical ones to get, a psychiatrist involved in your child's care.
All right. Thank you very much for that. And then beyond medication, what are some lifestyle changes that can help with managing ADHD?
Yeah. So one we had talked about a little bit already was trying to minimize the big transitions, big decision points, or maybe areas of tension within your home. So having a regular routine that you guys follow, like your weekdays, your weekends, and even a summertime routine, if possible, that you guys have is really helpful. Sometimes it can be helpful within that routine to even have like a little chart so that your child can reference, okay, like these are the 4 things that I'm supposed to do. I'm supposed to do my homework, and then I need to put the plates out for dinner. And then after dinner, I'm supposed to go brush my teeth, etc. I just have that visual reminder right there of how I can stay on task, and having maybe little charts around your house to help with that is really great. If your child gets really distracted of where they're like working on homework, maybe we like help them have them pick out what they want their little homework area to look like. They get to make their decision once, and then we say, okay, you could have 2 pencils, one, limit the choices and the things that are there, but it's an area that they know that's theirs. And it's predictable, and that's where they always go to do their homework. And then I think another big important thing is like find areas for your child where they're going to be really successful. So like if you find that your kid is, you know, doing really wonderful in, I don't know, music or sports or things, get them involved and find really a lot of opportunities where you can praise them for their behavior, and where you see them excelling and doing well, and giving them, like I said, graduated responsibility. I think sometimes kids with ADHD are hearing a lot of, especially when it's untreated, that, like stop doing this, stop doing that. And so it's great to give them opportunities and places to really shine and to praise them for the good things that they're doing.
All right. Yeah, you mentioned the working area. I'm going back to the classroom. You probably want a space that is limited by the no distractions, making sure other family members aren't distracting that person while they're trying to do their homework.
Yeah.
What about anything? What about, I think you mentioned sleep earlier, but what about sleep or diet? Are there any of those or exercise? Are there any of those correlations to helping your child with ADHD?
Yeah. So we know that having like a regular sleep routine, getting, solid 8 to 10 hours, depending on the age of your child, getting a good night's rest is important for everyone's mood and everyone's behaviors, as well as having a well-rounded, well-balanced diet is going to be great for everyone, whether they have ADHD or not. Some people, I think, have read about like, oh, we just need to eliminate this specific ingredient from our diet and that may fix everything. It's something to talk to your pediatrician about. From the studies and such that I've read, we've not found like a clear like elimination diet of a specific thing, but I'm sure that there are, rare cases out there where children need specific diets to help control. But I'd say well-rounded diet, getting a good night's rest is great for everyone and everyone's moods. So,
Thank you very much.
Yeah.
And what about, are there any consequences if ADHD is untreated? Are they, in my mind, there's potential behavioral consequences because, especially for a hyperactive child, if they are misbehaving in school, there's going to be consequences from the teacher. But can you talk about any other health-related consequences if ADHD is untreated? For example, could a child be at higher risk for other health issues if they are untreated?
Yeah. So in children that have, or individuals that have untreated ADHD, we can see higher rates of other things like anxiety or depression, which we know are not great for health. And we would want to help manage that. Kids are going to be more likely for, again, like making higher risk decisions, not always, thinking about, like when they get their driver's license, like driving normal speeds down the freeway and not going as fast as they can, not wearing their seatbelt. There's been higher risk of involvement in things like drug or alcohol abuse by those that have untreated ADHD. And then again, back to school and such, oftentimes we can see that gap start to widen in their school performance. And so grades can start to fall, more challenges in completing what they need to do to be successful and to be able to go on to things like college and such, or harder time holding down a job. So those are all things that we want to just make sure that we're always having ongoing discussions about, when we're talking about treatment, deciding, which child would really benefit from that, and making sure that we are supporting your kid as best as possible to help them live a happy, healthy, safe life.
Yep. Making sure happy, healthy, and safe, because if you're impulsive, and you mentioned earlier, not thinking about looking both ways before you cross the street. Yeah. That could be very detrimental to your child's overall well-being. They could get hurt if they aren't taking care of these things. Yeah. Thank you so much for that. We have some additional questions from our audience. Okay, so the first one is from Olesa, and her question is ADHD routinely screened during pediatric well visits? Was her first question. And the second part was, would a pediatrician refer a parent to would refer a parent to a child psychiatrist after a routine visit if ADHD is suspected. So yeah, the first one is ADHD routinely screened during pediatric visits, and would a pediatrician refer a parent to a child psychiatrist after a routine visit if ADHD is suspected?
Okay. So to address the first question, it probably depends on what pediatric office and such you go to. Within our office, we have a form that we have patients fill out between ages 6 to 11 that helps screen for some symptoms of ADHD. It is not as conclusive as like the Vanderbilt that we would use as a specific form to help address that. So if there's concerns based on that one, or if there's concerns that come up during our visit, then we would do more in-depth screening. And then the second part of the question, so if we were, I'm not sure if we're talking about the patient or the parent being referred. If there was concerns for parental, then you would need to speak with your own provider about that, and an adult provider regarding those things. Is for the child, potentially that's things that your pediatrician could field, but then if there was additional concerns, then they may warrant evaluation by either a developmental pediatrician or a psychologist or psychiatrist.
Okay, thank you very much. Question from Jen goes back to what you were talking about, diet, or specific things that a child shouldn't eat that could change the child's behavior. So Jen is specifically wondering what your thoughts are on red dye causing an increased behavior issues for kids with ADHD.
From what I have read in studies, that has not panned out to show anything. But again, it's something I would talk to your pediatrician about specifically. Because of course there can be the one-off child, but from what I've read about specifically with red dye, I've not read any increased correlation with those together.
Okay, thank you very much, and thank you, Jen, for your question.
Yeah.
I have a question from Heather related to medication. She wanted to hear the pros and cons to medication, and she asked if there is a vitamin cocktail that could be helpful.
So in terms of vitamins and medications, we've found that kids, like stimulant medications, are the most efficacious for kids with ADHD, and generally extremely well tolerated. Side effects that are the most common one we typically see will be appetite suppression, where the appetite actually goes down a little bit. The kid is generally doesn't notice it. It's more something usually that caregivers are aware of, and it's a reason why we check kids every few months, make sure that their growth is still great, they're still eating a good number of calories and such, and make sure that you're making appropriate dietary changes if needed. And then other common side effects too, maybe initially like some difficulty with sleep. Occasionally headaches are there, but usually that's a transient symptom. And then sometimes there can be a little bit of irritability as like the dose is wearing off. But in general, kids are really, many kids tolerate them very well. And if there's one that they don't tolerate as well for whatever reason, there's usually medications within that same class or kind of a neighbor class of medications, also a stimulant. Generally, we can find one that works really, really well for your child. And because they're so efficacious, that is our first line. Regrettably, we haven't found a specific like vitamin complex that has been nearly as efficacious as stimulant medications. Certainly, we want your child again to eat a well-balanced diet and such. And if you feel like a multivitamin is what your child needs to help support that, I think that's great. But unfortunately, no specific vitamins that I'd be recommending to that would be as helpful as stimulant medications.
Okay, thank you very much. Rebecca also had a medication question, and her question is, what are some adverse behaviors that can occur with medication?
So the most common one that we hear about probably is just as the dose is wearing off, that there can be a little bit of like increased moodiness and such towards the end of that, which sometimes if we switch them to a different class of medication, sometimes that gets better, or there just needs to be dose adjustments in there. but that's probably the most common thing that we hear of in terms of like kind of rebound behaviors and such, is more of the moodiness associated with it.
Okay, thank you very much. And then I have one more question from Alessa, and her question is related to ADHD screening in families with lower social economic status. What are we doing to encourage those families who may have less access or aren't getting diagnosed as easily as other families? What are we do to make sure that those families are getting the care that they need?
So I'd say first and foremost, biggest important thing is go to your annual well child check with your pediatrician. We, like I said, at our well child checks, we do some regular screening that screens for multiple behaviors, ADHD symptoms, as well as things like anxiety, depression symptoms, and developmental delays. We do all of that and cover those things at your annual well child visit, which is covered by pretty much all insurances, which is great. And so that's a great time to bring up those discussions. And I think is able to be accessed by pretty much all children, which is wonderful. And then additionally, like if you have your child in the school system and such, certainly please always check in with your teachers on a regular basis, whether your kid's doing great, and trying to know, how best you can support them, or if, grades come back, they're lower than you expected, or if they raise concerns about certain behaviors and such that they've witnessed in school. I think that's like a great screening that is offered basically by all teachers, just their observation and their sense as they've been around a lot of kids. And with those concerns, if there's anything, you can always certainly talk to your pediatrician. But well child checks are, I think, the most important and really great place to start.
Wonderful. Thank you so much. Another question came in. So I do have another one for you. And this is another one about medication. And this is from Jane. Her question is, what are the effects of puberty on ADHD and medication efficacy?
So sometimes as kids are growing, we may have to adjust the dose. And some kids do go through changes where maybe that medication was working great before, and some kids need to switch over to something different. It's really a case by case basis, but I think most commonly it's maybe that we just need to increase the dose a little bit just because they're growing, they're metabolizing things differently.
Great. Thank you so much. So continued conversations with your pediatrician, with your teachers, see how your child is doing over time, because there's going to be, I would imagine, a lot of different changes. And you talked earlier about a new baby coming in and how that could affect your child's behavior. So it makes a lot of sense to just continue to talk about what's happening in your child's life with your pediatrician during those well checks, and keeping their pediatrician posted on anything that might affect their ADHD or may change the medication or the treatment that they have. Yeah. All right. Well, that's all the questions that I think. I'm getting one more question. So I will ask that in just a moment, but I did want to make sure, is there anything that, or like a key takeaway even, that you want to make sure all of our parents, caregivers, anyone sharing this discussion today, what do you want to make sure that they get out of this discussion?
Yeah. So I think something that's important is, as you are rearing your children, always just be gathering data points about them. I don't think you have to feel like you have a magnifying glass and you're going to go searching for that ADHD and we're going to find it no matter what. But I think just always be gathering data points, looking at your children across, looking at how they're doing compared to other children, touching base with their teachers, and always asking, is there anything else that I can do to help support my child? And pediatricians, we're always happy to talk about your child's development if there's any concerns. We see lots of kids all the time, and so we can either be super reassuring and let you know what, your kid seems like they're actually like just in a great spot, and let's kind of keep an eye on things. Or if it seems like there's something more there, we're always happy to go and investigate that. I think always just kind of having a watchful eye on your kids and how they're doing is the most important thing. And if your child is exhibiting symptoms of ADHD, I never want a child to feel like they are labeled with this, that it's a problem. It's just a different way that they are processing the way that they go about living their lives in the world. And like I said, I want them to be happy. I want them to be successful and safe and healthy. And so that's really the goal. And when we talk about medications and such, it's really in light of that, about, okay, so is this the moment right now when we feel like that's needed to help your child be happy, healthy, and safe? Maybe that's not right then, and maybe it's something down the road. So it's a lot of ongoing discussion, and every child is unique in how we approach all of that.
Yeah, makes sense.
Yeah.
And I did, so I I got two more questions that
Okay.
came in while you were giving that. So thank you
Okay.
all. You're very engaged audience. This one is from Mandy. So she asked, do kids who are on meds for ADHD typically have to continue these into adulthood or for life?
Definitely case by case basis, and I certainly am a pediatrician, so I don't take care of adults at all. And so there are some that I know of that as they get older, they learn how to either manage their symptoms better, or the symptoms become a little bit less severe, and so we can do trials off of medication. Certainly, like I said, case by case basis. So it depends on the individual, and I think something that if you have received that diagnosis of ADHD and you do go off, it's just important to always have really close contact with your doctor to know kind of how those things are going and how you're able to keep up with your, activities of daily living. So, yeah.
Makes sense. Thank you so much. And then the other question came in from Sarah. We talked a little bit earlier when we were talking specifically about the different types of medications. She said she's heard about new non-stimulants. I know we talked a lot about stimulants, a little bit about non-stimulants, but what about any new non-stimulants? Can you talk about those?
Yeah, so I'm guessing she's referring to things like guanfacine or clonidine or atomoxetine. Those are ones that typically are not always our first line medication, but can be really helpful for a lot of children. And depending if they have other comorbidities, they may be the right choice for that child. So it's a little bit of a case by case basis.
All right. Well, thank you very much. That is all the questions that we have, and we're running out of time. So thank you so much. We covered a lot of wonderful information about ADHD. Thank you, Dr. Moll, for joining us and answering all of our questions. Thank you to our viewers for tuning in. We will have this broadcast available on our Facebook page, also on YouTube. So please share it with your friends and family. A lot of wonderful information that we shared today to help support our children. And if you'd like to schedule an appointment with our pediatricians, we will post a link in the comments, so you can certainly do that and start that conversation that we've been talking about that's so important. Thank you so much. Have a wonderful day. Dr. Moll, thank you so much. Really appreciate all your time.
Yep, great.